Minnesota free CNA practice test with answers 180 questions. Full questions. Question 1. A button hook and a sock assist are part of what kind of care? Option A. Restorative and rehabilitation. Option B. Activities of daily living only. Option C. Disability and reactivity. Option D. Prosthetic mobility. The correct answer is option A. Restorative and rehabilitation. Adaptive devices are used in restorative programs to help residents be independent. Question 2. When ambulating an unsteady client, what is best to use? Option A. A walker. Option B. A gait belt. Option C. A quad cane. Option D. A wheelchair. The correct answer is option B. A gait belt. A gait belt provides a secure place for the assistant to support the resident's balance. Question 3. The client's Bill of Rights includes which of the following? Option A. Free medical care. Option B. A freedom of choice. Option C. Access to the medicine cart. Option D. Access to the laundry room. The correct answer is option B. Freedom of choice. Autonomy and choice are protected rights for all residents. Question 4. Which statement might strongly support that a client is considering suicide? Option A. I think I need to see a psychiatrist. Option B. I might as well be dead. Option C. I do not really care. Option D. We all have to go sometime. The correct answer is option B. I might as well be dead. Direct comments about death or suicide must be taken seriously and reported. Question 5. A client answers every question by nodding and saying yes. How should you respond? Option A. Inform the nurse of the behavior. Option B. Ask a family member to translate. Option C. Speak to the client with medical terms. Option D. Shout at the client. The correct answer is option A. Inform the nurse of the behavior. Abnormal communication patterns should be reported as they may signal a mental change. Question 6. You gave a client the wrong diet. What should you do after realizing the error? Option A. Report the error immediately to the nurse. Option B. Ignore it and move to the next task. Option C. Remove the evidence of the error. Option D. Blame another nursing assistant. The correct answer is option A. Report the error immediately to the nurse. Honest reporting is necessary to monitor the resident for potential harm. Question 7. What should be done with hearing aids that are not in use? Option A. Placed in the client's pocket. Option B. Left turned on. Option C. Have the battery removed. Option D. Left on the bedside table. The correct answer is option C. Have the battery removed. Removing the battery prevents it from draining and prevents the device from whistling. Question 8. A family member asks what medication a client is receiving. What should you do? Option A. Allow them to read the chart. Option B. Tell them what is given. Option C. Refer the family member to the nurse. Option D. Give them the chart. The correct answer is option C. Refer the family member to the nurse. Nursing assistants are not authorized to discuss medications with families. Question 9. A client's religious beliefs do not allow them to eat certain foods. To whom do you report? Option A. The dietitian. Option B. Other nursing assistants. Option C. The charge nurse. Option D. The client's family. The correct answer is option C. The charge nurse. Reporting to the nurse ensures the care plan and dietary orders are updated. Question 10. An independent resident now asks for help walking to the bathroom. What do you do? Option A. Assist the resident and report the change to the nurse. Option B. Understand that this is a normal part of aging. Option C. Update the care plan yourself. Option D. Encourage them to do it alone. The correct answer is option A. Assist the resident and report the change to the nurse. Any sudden decline in function must be assessed by a nurse for a medical cause. Question 11. What should you do with a used disposable razor? Option A. Throw it in the trash can. Option B. Place it in a sharps container immediately. Option C. Clean and dry it for reuse. Option D. Wrap it in a paper towel. The correct answer is option B. Place it in a sharps container immediately. Used razors are hazardous sharps and must be disposed of in puncture-proof containers. Question 12. The Health Insurance Portability and Accountability Act is important because it does what? Option A. Allows residents to carry insurance between facilities. Option B. Provides insurance coverage for workers. Option C. Identifies protected health information that must remain confidential. Option D. Provides accountability for care. The correct answer is option C. Identifies protected health information that must remain confidential. Privacy of health information is a federal legal requirement. Question 13. Before leaving a resident who needs help to walk in their room, what must you do? Option A. Turn on the television. Option B. Make sure the bedpan is within reach. Option C. Place the call light within reach. Option D. Remind them not to walk alone. The correct answer is option C. Place the call light within reach. Ensuring the resident can call for help is the most critical safety step. Question 14. You notice new swelling in a resident's ankles while bathing. What is the best response? Option A. Ask if they have been eating salty foods. Option B. Elevate the legs and check again later. Option C. Report the swelling to the charge nurse. Option D. Avoid bathing the lower legs. The correct answer is option C. Report the swelling to the charge nurse. New edema can indicate heart or kidney issues and requires a professional assessment. Question 15. A resident has a contracture of the right arm. How do you put on a button front shirt? Option A. Put the left sleeve on first. Option B. Ask which arm they prefer. Option C. Put the right sleeve on first. Option D. Put both on at the same time. The correct answer is option C. Put the right sleeve on first. When dressing a resident with a limitation, always dress the affected side first. Question 16. When weighing a resident, it is important to make sure of which of the following? Option A. The last weight is available. Option B. The scale measures kilograms. Option C. The resident is in pajamas. Option D. The scale is balanced or calibrated first. The correct answer is option D. The scale is balanced or calibrated first. Starting with a zeroed scale is necessary for an accurate measurement. Question 17. A resident reports his watch is missing. What should the nursing assistant do? Option A. Ask if he thinks someone took it. Option B. Check the lost and found. Option C. Ask who worked the previous shift. Option D. Ask for permission to help look around the room. The correct answer is option D. Ask for permission to help look around the room. Assisting the resident while respecting their privacy is the first step in finding lost items. Question 18. What is an acute illness? Option A. A sudden illness from which the person is expected to recover. Option B. An ongoing illness with no known cure. Option C. An illness that will result in death. Option D. A slow and gradual loss of function. The correct answer is option A. A sudden illness from which the person is expected to recover. Acute illnesses have a rapid onset and are generally short-lived. Question 19. What is a chronic illness? Option A. A sudden illness that is cured quickly. Option B. An ongoing illness with no known cure. Option C. An illness that only affects children. Option D. A temporary loss of memory. The correct answer is option B. An ongoing illness with no known cure. Chronic illnesses like heart disease require long-term management. Question 20. What is a terminal illness? Option A. An illness from which the person will recover. Option B. An illness that will not result in recovery and will lead to death. Option C. A type of skin infection. Option D. A broken bone that will not heal. The correct answer is option B. An illness that will not result in recovery and will lead to death. Terminal illness care focuses on comfort and dignity during the dying process. Question 21. What does ALR stand for? Option A, Advanced Life Resuscitation. Option B, Assisted Living Residence. Option C, Ambulatory Leg Rotation. Option D, Acute Liver Recovery. The correct answer is option B, Assisted Living Residence. An assisted living residence provides housing and support for daily activities. Question 22. What is the role of the Director of Nursing? Option A, to cook the facility meals. Option B, to manage the facility's finances. Option C, the registered nurse responsible for the entire nursing staff. Option D, to drive the resident transport bus. The correct answer is option C, the registered nurse responsible for the entire nursing staff. The Director of Nursing is the highest clinical authority in the facility. Question 23. What is a skilled nursing facility? Option A, a facility for independent seniors. Option B, a place that provides 24-hour care and rehabilitation. Option C, a hospital unit for emergency surgery. Option D, a group home for teenagers. The correct answer is option B, a place that provides 24-hour care and rehabilitation. These facilities provide high-level nursing and therapy for residents. Question 24. What does it mean if a resident is alert and oriented times 4? Option A, they know their name only. Option B, they know where they are. Option C, they are aware of self, place, date, time, and events. Option D, they are confused about the date. The correct answer is option C, they are aware of self, place, date, time, and events. This level of orientation shows the resident is fully aware of their surroundings. Question 25. What is the purpose of respite care? Option A, to provide permanent housing. Option B, to provide short-term care to give a home caregiver a break. Option C, to provide emergency trauma care. Option D, to perform major surgery. The correct answer is option B, to provide short-term care to give a home caregiver a break. Respite care supports family members who are caring for loved ones at home. Question 26. Who helps a resident restore physical function such as walking? Option A, occupational therapist. Option B, physical therapist. Option C, social worker. Option D, a dietitian. The correct answer is option B, physical therapist. Physical therapists focus on mobility, strength, and balance. Question 27. Who helps a resident return to their activities of daily living? Option A, a physical therapist. Option B, social worker. Option C, occupational therapist. Option D, pharmacist. The correct answer is option C, occupational therapist. Occupational therapists focus on adapting environments and tasks for daily use. Question 28. What is Medicare? Option A, federal health insurance for people over 65. Option B, health insurance for children only. Option C, a program for low-income families. Option D, private insurance for employees. The correct answer is option A, federal health insurance for people over 65. Medicare is the primary insurance provider for the elderly in America. Question 29. What is Medicaid? Option A, insurance for people over 65. Option B, a program sponsored by the government for low-income individuals. Option C, insurance that only covers surgery. Option D, insurance provided by a local church. The correct answer is option B, a program sponsored by the government for low-income individuals. Medicaid provides healthcare coverage based on financial need. Question 30. What is the primary role of an ombudsman? Option A, to manage the nursing schedule. Option B, to help residents voice grievances and protect their rights. Option C, to perform surgeries. Option D, to clean the facility. The correct answer is option B, to help residents voice grievances and protect their rights. An ombudsman is an independent advocate for residents in long-term care. Question 31. What are ethics? Option A. The rules of a card game. Option B. Knowledge of right and wrong. Option C. The laws of the state. Option D. The medical history of a resident. The correct answer is option B. Knowledge of right and wrong. Ethics guide the professional behavior of healthcare workers. Question 32. What is the medical term for high blood pressure? Option A. Diabetes. Option B. Hypertension. Option C. Hypotension. Option D. A stroke. The correct answer is option B. Hypertension. Hypertension is a chronic condition that must be managed to prevent complications. Question 33. What is the term for low blood pressure? Option A. Hypertension. Option B. Hypotension. Option C. Hypoxia. Option D. Hyperthermia. The correct answer is option B. Hypotension. Hypotension can cause dizziness and increased fall risk. Question 34. What is the standard unit of measurement for fluids in healthcare? Option A. Ounces. Option B. Milliliters. Option C. Pounds. Option D. Meters. The correct answer is option B. Milliliters. Milliliters or cubic centimeters are used to track precise fluid intake and output. Question 35. How many milliliters are in 1 ounce? Option A. 10. Option B. 30. Option C. 60. Option D. 100. The correct answer is option B. 30. 30 milliliters is the standard conversion used for fluid calculations. Question 36. What is the medical term for breathing in? Option A. Exhalation. Option B. Inhalation. Option C. Apnea. Option D. Dyspnea. The correct answer is option B. Inhalation. Inhalation is the act of bringing air into the lungs. Question 37. What is the medical term for breathing out? Option A. Inhalation. Option B. Exhalation. Option C. Tachypnea. Option D. Bradypnea. The correct answer is option B. Exhalation. Exhalation is the process of removing carbon dioxide from the body.